So hey, I'm Jared Bowden. I'm the health officer for Butte County Public Health. We're making this video today just to give some updates on the situation with E. coli 0157 outbreak that's linked to Big Chico Creek. Some big updates are we are now working with the water board to try to do more testing. So our plan is to test the creek again. We're going to go through and do a couple different tests along the creek just to make sure that is the E. coli 0157 still there? Is it still living in the creek? We're also planning on doing some additional animal testing as well. So we'll be testing some other animals that we didn't test last time. We appreciate everyone's patience with this whole process. It's been long, and testing the creek, the sediment in the creek, the animal species, it takes a while, and we appreciate the patience. So we asked the people of Chico and the people of Butte County if they had any questions, and we want to answer those questions. First, we got a question, is it rare for E. coli 0157 to be in the water? In fact, it is. It's very rare. It's highly unusual that E. coli 0157, now this is a very toxic strain of E. coli, lives in a body of water. No less lives in a body of water that is a running stream. It's very abnormal. Another question we had is, are the creeks still being tested? Yes. As we mentioned before, we are now working with the water board to do some additional testing. So we're going to be testing at multiple locations throughout the creek. We don't have a regular schedule right now in which we're testing because the investigation is ongoing. So we're trying to test in certain places that give us information in order for us to identify the source. However, we are still concerned about people's safety, and so we do plan on testing at locations where people swim, places like Sycamore Pool, places like 5 Mile. Another question, how often or have we been testing animals? So we have tested one animal thus far. We've tested a bunch of geese. Those geese came out negative for E. coli 0157. So now we plan on looking at additional sources. We're planning on looking to see if this could be deer, if this could be related to some other bird species. It's very common for E. coli 0157 to live in large ruminants like deer and cattle, and then being spread from those creatures to the creek by birds. So we want to kind of look at both of those species. Could we start doing the testing in Butte County so we don't have to send them to the CDC? So yes, the lab part has been an issue, and CDC helped us with that initial testing. But now the CDC is unable to do more testing. And we've now been working with the water board, and we're using the water board's lab. In the future, we may consider trying to do more testing here within Butte County and kind of building out that capacity. But for right now, we're really following the water board's lead. What about long-term monitoring? This is a great question. So for long-term monitoring, what are we going to be doing next year? Are we going to be testing again? Most likely, yes. We are going to be doing some additional testing then. We haven't quite figured out how often we would be testing for 0157, whether we would be testing for 0157 specifically or just generally E. coli species, but it's something we are actively thinking about. One really big question, probably the most common question I get when I'm talking to people, is how do we know that this isn't due to homeless people living in the park? This is something I get a lot of questions about. And to be very clear, we don't have a source yet of the E. coli 0157 outbreak. But we don't think that it's humans. And there's a couple reasons why. First of all, the 015, we have found E. coli 0157 throughout the whole creek, even up to places like 5 Mile. And so most of the humans that are living in the park are usually living farther downstream and not that far upstream. Also, humans don't typically carry E. coli 0157 for longer than about 2 weeks. We have confirmation that the E. coli 0157 has been in the creek since the beginning of June all the way to the end of July. That's 2 whole months. So it'd be very unusual for a human to kind of keep that infection for that long. There's also, the most important part is we haven't had one human case of someone who is homeless living in the park. If someone gets this disease, usually they go see a doctor. Usually they go to the hospital, and then the hospital tests them. We've had no human cases thus far of people who are living in the park, or even of people who are living around the park. And then there's some question about volume. Usually to have this much E. coli 0157 at multiple parts of the creek, you would need a lot of creatures to be contaminating the creek. So one person, it'd be very unlikely for one person to do this. We also get a lot of questions about septic tanks. Could this be septic tanks? And this is where things have gotten really interesting. So we have been working with the state health department to do whole genome sequencing. This is where we can see for sure if two E. coli 0157s are genetically identical. And in fact, all of our human cases and the ones that we're testing in the creek and in the sediment are genetically identical. Now, E. coli 0157, it mutates, and so usually it doesn't stay identical. So we know that this is coming from one source. So it's very unlikely that this is multiple septic tanks because those would have different types of E. coli in them. This is one source. And then it comes back to the same question of humans are only infectious for about 2 weeks, so probably a little less likely that it's something from a septic tank. And most importantly, if you look at any of the outbreaks of E. coli 0157, almost all of them have been linked to animals. So we really just don't think it as humans. Now, that being said, we're doing an active investigation. We are looking at these areas where we are finding 0157, and certainly if we find new information, we'll let everyone know, and we have not ruled out anything thus far. Here at Public Health, we're happy to answer any of these questions at all times. We are here to help the public. We are Butte County's Public Health Department. We are your Public Health Department. So we, again, appreciate the questions. We appreciate any feedback, and we will certainly be keeping everyone updated. Thank you.